The views and opinions expressed on the following program are not necessarily those of the staff and management of Salem Media of Hawaii.
Aloha and welcome to Be Fit for Health radio show. Thank you so much for joining me today. This is Bianca, your host, and we have another incredible show for you lined up. You know, with everything that's going on out there in our world with the COVID-19 getting its second round of surges and getting more people infected and people concerned about their health and well-being and their immune system. I thought about bringing back on the two doctors I had before. We had Dr. Candido and Dr. Benchouk on our show before, and we were talking about hormone health and for Men's Health Month in June. But these guys just don't, work with hormones. They work with other realms as well to help you get balanced and get your immune system back to alignment. So, I was thinking about IV therapy, and they do that in their clinic, and I wanted to bring them on as our experts to talk about what is IV therapy exactly? How does it work in our bodies? What is in it? And how does it work to boost our immune system, or at least bring us to a place where our nutritional value is at a place where our body is absorbing what it needs to be healthy? And, I think this is something that not a lot of people know about, but it is starting to pick up. And it has been around for a while, but it's starting to pick up as far as people getting more and more information about it. And I thought, you know what? Instead of guessing, let's bring on those two doctors back on and let's see what they can teach us today. So as far as Dr. Stephen Benchouk, he's someone I've given you guys his bio, but he's been someone who's traveled and lectured and taught a lot of different groups of people when it comes to understanding our health. He was born in Geneva, Switzerland, raised in Philadelphia, Pennsylvania. He's got his pre-medical training in Hahnemann University and the University of Pennsylvania. He received medical degree in Southwest College of Naturopathic Medicine and Health Science in Tampa, Arizona. And his clinical training was completed in Southwest Naturopathic Medical Center and the inpatient outpatient naturopathic clinic in Arizona as well as here in Hawaii. He's also completed his internship and residency in rheumatology, pain management, IV therapy, what we just talked about, naturopathic oncology. Those are patients that may have cancer, and also environmental medicine, inpatient addiction recovery. So, he's a well-rounded doctor. Lucky and blessed to have him on the show again today. And we also have Dr. Carolyn Candido. She's an MD, born and raised in San Diego, California. She has received her medical degree from the University of California, Davis, and completed her family medicine residency at the University of Southern California, Los Angeles. She was a winner of a Wheel Foundation grant and started integrative medicine track for her residency program in California Hospital Medical Center. She's completed training in integrative medicine through the University of Arizona Integrative Medicine and Residency in the Institute of Functional Medicine, which I love. She started a functional medicine practice in Carlsbad Integrative Medical Center. Prior to joining Hawaii's Natural Medicine, she specialized in hormone replacement, thyroid disease, IV therapy, great, and detox therapies. Dr. Candido is committed to educating all of the medical community through organizing functional medicine forums and board member to Learn Skin Integrative Dermatology platform. And she is someone who also believes in empowering patients becoming heroes in their own health journey instead of victims of their disease, which I love as well. So I want to welcome these two fantastic doctors. Who's on with me today? Dr. Candido, Dr. Benchouk, are you on? Oh, they must have slipped off. So we're going to get them back on. So anyways, when it comes to our well-being, I have done IV therapy before. This was a while ago, and I was lucky enough to get glutathione shots. And glutathione shots, if you guys don't know what glutathione is the master antioxidant. So if you have any type of an ailment and you're trying to combat any type of, fatigue, or if you have a cold or you have something going on that you just can't understand, glutathione is actually used for multiple purposes in helping our bodies combat any type of bacterial infections and things like that. But when you get a glutathione shot, from my experience for my body, because I have fibromyalgia, and that is an autoimmune disease, and it does cause you to feel that fatigue and a lack of energy. It usually affects me in the beginning. I have a little bit of a sore stomach. I kind of feel a little out of sorts, like I'm getting even sicker. That's because all the toxins are being released in my body, and it's doing its job. So when I think about, the IV shots, it's sometimes can be a interesting experience, but at the end of the day, when you've gone through the hump of the feelings, it can be very beneficial. So let's see. Do we have any of the doctors on now?
Yes, we're here.
Hi, guys. Thank you so much for being patient with us today and coming on. I gave your introduction, your bios. It's always impressive to read. But I also want to say thank you so much for educating us today. Before I forget to do that, I want to say thank you, because I think IV therapy is something that I wanted to talk about for a while, and having you guys on here to discuss what you do at your clinic and how you help so many people, get to a balance when it comes to the nutritional ability to absorb certain types of vitamins and minerals and other things. I want to get into it with you guys if I can. Besides the hormone conversation we had the last time, which is really great, can you explain a little bit to me what is IV therapy and why is it picking up momentum?
Yeah, IV therapy started decades ago, actually. Dr. Myers created this cocktail, and it was used for a variety of different conditions, everything from migraines, chronic fatigue, colds, flus, you name it. And ever since then, naturopaths and integrative MDs we've been using that as one of our sort of main tools. As more and more studies come in regarding what these vitamins, minerals, amino acids can do, the more things that we could apply it to. And then a gentleman in Linus Pauling was using high doses of intravenous vitamin C for cancer treatment. Right. And when you say high doses, I mean, back then it was a high dose of, say, like 10 grams. And now for integrative oncology, it's relatively a low dose.
Oh.
Yeah, and so we've been using IV therapy for years. It kind of made it came back sort of with the Las Vegas hangover buses and things like that. Right. And then celebrities kind of started doing it and posting stuff on Instagram, and it became very popular and sort of trendy. And now a lot of, say, like kind of like med spas are doing, I would say IV therapy, like IV drips and things like that for energy, for hydration. Right. Colds, flu, and hangovers is a big one.
Right. A lot of drinkers out there.
Yeah, I mean it is an easy way to rehydrate. So the benefits of, say, doing an oral vitamin versus IV. For one thing, you're only limited to what your body can absorb when you take something orally, right? Mm-hmm. And you're limited to your digestive system. And everyone's a little bit different. And sometimes as we get older, or if we have any chronic inflammation going on in our GI tract, it's a little bit harder for us to absorb certain nutrients.
Right.
With the IV therapy, it's not an issue because we're bypassing the digestive tract, going straight to the cells.
Right.
So not only are you absorbing it, but you're absorbing it at a much higher rate. So take for instance, vitamin C. You can take orally. You get to a limit, basically what we call bowel tolerance with vitamin C, where you take so much it gives you diarrhea. Your body just can't handle it. Same thing with magnesium. But if you're doing an IV, you can do much higher doses, what we call a therapeutic doses. And you don't get those side effects. And also, you're going to absorb that vitamin C, depending on what study you look at, 30 to 100 times more than doing oral. Yeah.
And that's necessary, too, especially with today's situation where people may not be eating properly and they're just lacking in those nutrients. It's a great option for them because you don't know if your gut's absorbing enough of the nutrients. I mean, to some degree, depending on how you feel, but you don't know how much of it's being absorbed.
Yeah, and I even athletes come in who are doing everything absolutely correct,
Right.
but yet they were still having muscle cramps. They're taking potassium, magnesium, super hydrating, everything, and just no matter what they did, they would just cramp up every time they were performing. Until they did the IV, then all that went away. So, for whatever reason, they just were not absorbing that magnesium orally at all.
Isn't it true that magnesium is absorbed in the large colon, and that's where it's mainly absorbed? Is that true?
That's part of it. I think a lot of it is the small intestine. Magnesium is one of those things where you take too much of it, it becomes a really good laxative. Basically, it kind of goes through you. And it depends on the form of magnesium you're taking.
Okay.
So like a magnesium citrate, yeah, you definitely have a bowel tolerance, but things like magnesium taurate, you can take that, and it'll never sort of cause diarrhea. You can keep on going higher and higher levels.
Interesting.
Like milk of magnesia, that's old school. That's just magnesium.
Yeah.
Yeah.
That's crazy. Well, I find that's really interesting too, because a lot of people take a lot of supplements, the oral version versus now the IV, which is becoming so popular. And you still don't know if your body's going to absorb that. And you're eating the good stuff. Like you said, the athletes do the right thing. They take their supplements, they're taking, they're eating good stuff, and they're still limited in the way that their body is, understanding what it's ingesting. So there is that disconnect somehow, some way. And you would, attribute that to your gut health, right? Your gut's ability to do its job. So I guess IV therapy would be, until you fix your gut, would be the way to go to at least guarantee some of those nutrients being absorbed.
Sure, absolutely. And some things, our body, there's supplements people take like glutathione and these large molecule amino acids, and they really don't pass the digestive tract very well. They're not very, but they're just kind of broken down. So you don't really get that magic until you do it with the IV.
So
you see some amazing results.
My question would be, because I've had this experience, I've had glutathione injected in me because I felt like I needed the extra help with breaking, helping with my antioxidant support. Oxidative stress levels were probably high at the time, but I felt kind of, I don't want to say nauseous, but I felt a little sick to my stomach in the sense, or it made my stomach sore. So what is that response? But not everyone's going to have that response, but what is that response to IV injection? Is it because it's oversaturating too quickly?
Yeah, a lot of time, especially when someone first comes in, they've never done IV therapy. I always go very gentle, and I don't, I pull back the dosing, and you really want to do test doses in a lot of these cases. Glutathione, for the most part, people, if you don't push it too fast, sometimes if whoever's giving it to you is pushing it too fast, or it's too concentrated, they can make you feel a little icky.
Yeah.
Some people have no problem with that. Some people, you do it really, really slow, and they still kind of feel a little queasy with it. But bottom line is, if you're doing IV therapy, you kind of want someone that knows what they're doing, and especially if it's your first time, you want someone that's going to be kind of gentle with you and kind of go slow with you. Because, anything that's kind of giving you too fast might make you feel a little queasy.
Right.
And sometimes there's some things you can take, like molybdenum, that can help with that. You would load up with that before doing glutathione.
Oh.
And a lot of times it can help with sort of any sort of side effect you might have from doing that.
Good to know.
Yeah.
Yeah, I'm sure there's tricks to the trade, like, things that you should know prior to. And I think that's great. That would be my next question. So what would a patient or a client of yours expect when they get, let's say, the basic IV, which is the Myers cocktail you're talking about? How would they feel afterwards, or what would they expect to feel?
Well, it kind of depends on kind of what your baseline is, right? What are you coming in? What are your health goals? Because a lot of times, Myers is kind of like the base, right? and we build on top of that, right? So when someone comes into our office, we have IVs on our website that kind of let you know what the IVs can do. But once you're in the office, we're going to talk to you and see what would be right for you.
Got it.
So if your health goal is, hey, I just want to boost my immune system, then okay, we're looking at vitamin C, zinc, selenium, things like that. And generally I always tell people, come in, try to eat something before your IV, hydrate. That way it makes venous access a little easier if you're well hydrated. And basically, the process is very simple. You might taste some of the vitamins. That's not unusual, especially with B complex. And everyone has a different response, and I think it depends on the person's vitamin status. I've had people, not notice a big difference right away, or sometimes they feel a little sleepy, and then their energy goes up. I've had some people just, jump out of a chair and they just feel energetic right after the IV. So different responses for everyone, and generally people feel better, but it's kind of finding out what your health goals are. If you're just doing an immune cocktail, you might not necessarily get this big energy boost unless that's one of our goals.
Right.
And when we're looking at energy, we're looking for clean energy. So it's not like we're giving you like 5 cups of coffee and you're going to feel jittery or anything like that. It's like things like B12 and the B vitamins. It's kind of a smooth energy. It's a clean energy. So less drop-offs, during late in the afternoon. Some people report that they sleep better at night because you got to remember the B vitamins are cofactors for the neurotransmitters.
Right.
Serotonin, dopamine, acetylcholine all need B vitamins. So it kind of helps balance out some of your neurotransmitters. And that's why they're called the stress vitamins, because they get burned up. The more we stress, the more we burn up these cofactors. So by replacing that, people often feel kind of a feeling of wellness after they do this. And then things like some people are just dehydrated, and you just put, okay, let's focus a little bit more on hydration and electrolytes. And people feel great after they're more hydrated. They go and they work out. They get better results. So yeah. So like I said, everyone's a little bit different. It's just about talking to the patient, getting their health goals, and see what they're looking for.
So what do you guys provide in your office? I mean, I kind of did a skim through because, I am going to visit you guys next week. I am interested in getting IV therapy. Because I went and everyone knows my business here in this show, but I was in the hospital about 2 months ago for a small bowel obstruction. So I'm feeling like possibly I'm not going to be absorbing the type of nutrients I want, and that's why I'm coming in to see you. So, you have an immune boost, which consists of what items in it, like what's in it.
So for the immune boost, some of the key ingredients is going to be the vitamin C, of course, zinc, selenium, and cofactors, calcium, magnesium, and some of the B vitamins for cofactors as well. But those are the things we want to kind of focus on. So we'll put higher levels of the vitamin C for sure. And if you're having problem absorption, like for people with gut issues, some minerals and some amino acids would be very helpful.
Right.
Because you might not be, a lot of times too, people will bring in their lab work and we can check that out. If we're doing sort of like a full consult with them, we can always order labs or have people bring in some lab work and kind of look at that. Because there's tests out there which will go down and do a nutrient analysis.
Oh, interesting.
That are very, very, very specific, and we can take a look at that and see where your deficiencies are. So we can, but a lot of times too, we got to remember we're using a lot of these vitamins, minerals, amino acids in therapeutic ranges.
Right.
So despite your deficiency, we're going to give you might not be deficient in say vitamin C, but the therapeutic dose of vitamin C we give you is going to be above what you would get in say your normal everyday recommended daily allowance. Of course, we're using these nutrients almost like medicine, right? We're using to create an effect.
Got it. Yeah, that makes sense. I mean, and then if you have someone that also has an autoimmune disease that comes in because they're feeling like they're getting too much inflammation in their system, you guys have IV therapy for that as well, correct?
Yeah, that's more complex. That's generally consisting of an office visit where we're creating a whole treatment protocol. Mm-hmm. So there's a lot of natural inflammatories. So you talked about glutathione.
Right.
Glutathione can be used as an anti-inflammatory, especially a neuro anti-inflammatory.
Right.
Glutathione is actually used in Parkinson's disease. There's studies with it.
True. And big changes that occur immediately after it's been used. There's a lot of documentation on that where people have gotten in. I think Michael J. Fox is the one who actually brought it up where long time ago where he was trying to get glutathione as part of the treatment for Parkinson's way back when. And, with other things, but it was really interesting to see how someone gets an injection of glutathione that has Parkinson's, and a few minutes later, the guy is able to talk and walk and move much more fluently than he did maybe moments ago. Mm-hmm, mm-hmm. Very interesting studies.
Yeah, and vitamin C can help regulate the immune system because you're talking about inflammation,
right?
Or people that have autoimmune conditions. Yeah, a lot of these vitamins can help regulate the immune system, which is important. Then we have sort of like more advanced IV therapies like ozone therapy, which kind of operates at a different level. But yeah, like I said, for someone who has autoimmune, some people, I've had people with RA, rheumatoid arthritis, right, lupus, things like that, and come in with a flare, and they do feel a lot better. Now, I wouldn't say use it as a solo treatment, okay, don't go to your rheumatologist anymore, anything like that.
Right, of course.
But although there's some people that, they kind of refuse to do anything conventional.
Right.
Not that we advise that, but even in their case, they do feel a lot better. But a lot of times, like we say, we're integrative doctors, so we're looking at doing conventional and alternative, and kind of getting the best of both worlds.
Well, I always say Western medicine has its place. You need it, but we also need to look at other options too, because IV therapy makes sense to me because especially if you're someone who doesn't have a very good understanding on nutrition, you don't eat properly, and you're sick, and you're getting these issues and more symptoms, and you need that extra dose of vitamins and amino acids and antioxidants and things like that in your body to be able to combat it. I think my saving grace in life, because I have fibromyalgia, is that I've had enough smarts to be surrounded by doctors like you to teach me that there are options like this out there. And I've done ozone therapy. I've done the injections before, and it's made a big difference, and it's kept me going. I'm not on medication for fibromyalgia. But it's because I've been working with multiple different types of physicians like yourself and keeping me on my feet and being able to talk about this on a very personal level because I've experienced it with these types of treatments. So I find it very rewarding to be able to sit here and talk to someone like you who's actually taking it to the next level, because I think your guys' IV is a bit more intensive than other places that I've seen.
Yeah, I mean, if you're looking for IV therapy versus kind of like the sort of Vegas drip sort of thing, it's different because a lot of those kind of med spas, they might just go to a conference, and maybe they have like one session there where they're kind of getting the recipes, and basically it's like, okay, add this to your services, on top of like. If you're a med spa, you might be doing other things, but
laser therapy, or you're doing facials and some others, higher technology on that stuff. Yeah, it's different.
It's helpful, and I always say too, I'm always learning with this stuff. I mean, we constantly go to conferences and learning new things, and to us, it's always a challenge, and every patient is different.
Right.
So we're always learning new things about it, and me and Dr. Candido are pretty highly trained. She's trained in functional medicine. I'm a naturopath.
Right.
So we're used to using, nutrition as treatment, as medicine. And the IV therapy kind of takes that, well, let's take that to the next level, right? Let's get these nutrients and deliver them right to the cells. So, it's a little different than, say, going to like the Vegas and kind of doing a drip. But not to say that I think that has its place, but I think it's when you look into fibromyalgia and chronic fatigue syndrome and things like that, that gets a little more complicated.
Right.
And since you're saying you did glutathione and you feel a little queasy,
that tells you I'm going to add some toxic load or something.
You're right. So not knowing that about you now that I know you had fibromyalgia, that's not uncommon with people that have fibromyalgia. They're a little bit more sensitive to the IVs, and sometimes what happens is you get this healing response where you detox, and you can, in some people, they'll feel a little worse, but they'll feel better. Right. You know, I'm sure you're aware of that. That perks, that reaction, that healing response.
It's not fun, but I know the end is coming, so I hold on.
and that's with fibromyalgia, you hear that a lot.
And it's okay.
Yeah.
I mean, it's at the end of the day, you're doing good for your body. So you got to suffer a little bit. I mean, anything that's therapeutic, you're going to have your body reacting to it, especially if it's been a certain way for a certain amount of time. Because we don't know what causes the toxic load. It can be your environment. It could be the foods you're consuming. It could be anything. Sure. So, I mean, and it's embedded in your cells, and it's embedded in your liver, the way the liver processes and filters things out. I mean, you don't know, but I think you got to start somewhere. And I appreciate how you guys approach it in a gentle, more conservative manner when it comes to giving these therapies, because a lot of you don't want to turn people off. You want people to come back and keep doing the therapies, you know. You don't want to put fear in them because it's going to be uncomfortable. But not every therapy is uncomfortable. I think it's going to be very interesting to say that you guys do so many different things in your clinic. It's really interesting. Like, it's almost departmental, but you combine it all together in one. Yeah, it takes a bit of a work to figure out the elements.
Yeah. It's a holistic approach, and you're right too. It's just like, when it comes to chronic fatigue and fibromyalgia, they're already feeling lousy anyway, and it has these fluctuations. So, and anytime you're activating that immune system. So, say we were testing someone with fibromyalgia or chronic fatigue, they have high Epstein-Barr virus and antibodies or something like that. Yeah, you're gonna, and then you activate that immune system to help fight that. Yeah, you're gonna feel a little under the weather if that's the case. But,
yeah.
But that's only in in those cases where, chronic fatigue and fibromyalgia, those ones kind of tend to be a little bit more. But a lot of times too, they feel great. They feel a lot better after doing the IV too.
Right.
It's just like going back to finding out what's right for that patient, right?
And I'm sure it's even more complicated with patients who have cancer. I'm sure you guys have to do much more intensive work with them so that they're getting their nutrients without really putting them under more of an exhausted state, because they are dealing with so much. Their body's dealing with so much at the same time.
Yeah, it can be really great for cancer patients, as you know. Like I said, Linus Pauling did that study back in the day using that relatively low dose and vitamin C, and then since then, the dose has kind of raised up now to 50, 7,500 grams, and more studies have shown that there's definitely an anti-cancer effect with that vitamin C. And now we know too what chemotherapies seem to synergize with high-dose vitamin C.
Right.
So it can actually help chemosensitize the cancer cells to the chemo. So if you're doing conventional, it can help synergize with that. So like I said, working with the patient on an integrative basis and doing what's best for them. And in some cases, it's just kind of, just giving them the nutrients that they've been sort of, burning off at a rapid rate because they've been, because of the cancer, because of the treatment and things like that, and just giving them back some of those vitamins and minerals just makes them feel a lot better, in that regard as well. So there's supportive care we can do for cancer patients, and then there's sort of more of a sort of direct, anti-cancer we can't say we're not treating cancer, of course.
No, of course.
We can't say that, but
you're supporting
definitely
the process.
is supportive of that.
Yeah. Well, I find it very, very interesting, and I really do want to encourage those who are going through something and don't understand it. And maybe you're seeing your doctor, and the doctor is giving you what they think you need. But then if you're feeling like you need more, I would strongly suggest you guys go and check out Dr. Benchouk and Dr. Candido at the Hawaii Natural Medicine. You guys are located in downtown, right? Right off of Bishop?
Yes.
Yes, you guys are off. Dr. Candido, are you on?
Yeah, I'm on.
Okay, great.
Sorry, I've been blabbing away here.
No, it's awesome. No, that's fine. I wanted to hear from you because I know that you also, when I asked you to give me some insight as to how to boost your immune system, you also put on here, as I'm looking through it, you're talking about garlic being a potent antimicrobial and oil of oregano. Can you tell me a little bit about the three items, like the colostrum, the oil of oregano, garlic? And how is that in conjunction with our immune system being boosted?
Yeah, I'd love to talk about the supplements. I think that when it comes to boosting the immune system, the media hasn't really talked about that in prevention of COVID. They just talk about medications as well as vaccines, but there are so many supplements that help boost the innate immune response, which is what your body needs to have fight natural killer cells, neutrophils, macrophages. Those are the first line of defense when it comes to identifying virally infected cells. So the innate immune response is actually supported by things like colostrum. Colostrum is the first first milk of a mother. In this case, we use the colostrum from cow's milk, but it's rich in immunoglobulins. It's actually, it contains transfer factors which help identify infected cells to allow the natural killer cells to do their job so that they could identify those cells and eliminate them. So it's really important to support our innate immune response, and things like garlic and oregano oil are antiviral, antibacterial. Especially when I have a cold, I take a little bit of oil, like just one drop of oil oregano in some water and drink it. And it's something that you can drink, as prophylaxis, or when you do have the cold. I think garlic as well. There's, of course, ginger,
right.
Turmeric. So there's natural foods that are antiviral, antibacterial. And if you, for example, if you look at turmeric, if you have a turmeric paste, I've done this in foods that are preserved, with herbs. They don't mold. They don't go bad as fast, especially like hummus. I'll use hummus as an example. When I have turmeric in it, it stays fresh forever. So it will help with fighting bacterial, viral infections, and of course you can get it locally. I think that we should use food as our medicine.
Right. And
we can get a lot of supplements as well to support our body in fighting viruses, not just COVID. And I think, there's definitely a lack of understanding of why should we be taking zinc or selenium or vitamin C or vitamin D. All of these vitamins help support the immune system. And the dosing, I can give you specific dosing later, but really important. You could just take. You can go to the grocery store and get some zinc, but it helps with the natural killer cells as well in being able and macrophages in order to kill those infected cells. And I recommend taking 30 milligrams of food,
right,
as well as selenium. And we talk about vitamin D and C, but selenium is so important with the innate immune response. And it also helps regulate excessive immune response.
Oh.
For example, you don't want to have too much of a immune response and create a cytokine storm.
Right.
So selenium and vitamin C are very important with modulating the immune system. It helps with, for example, vitamin C helps the the immune cells create reactive oxygen species internally in the cell so it can fight and kill off the infected cells. So it is really important to have vitamin C so it can kill microbes more effectively. And I think vitamin D as well is very important with the immune response. And I usually dose vitamin D at like 5 to 10,000 units per day.
Yeah, makes sense.
You can do vitamin C at high doses, but as Steve was saying, that you could have diarrhea if you have too much vitamin C. But you can tolerate higher and higher doses if you're sick. If you're, a healthy person, maybe 1,000 or 2,000 might give you a little loose stool. But if you're like sick with a cold and you can't go to the doctor's office, you can take it, every hour until you start getting loose stools. And some people can go up to 10,000 units, and that's when you reach the saturation point, and your body needs vitamin C when you're under stress or when you have an infection, because it's so important in killing microbes, and it's also a cofactor in producing neurotransmitters. So I think it's very important that we take, our vitamins, but sometimes people can't absorb them, and they're not eating the proper amount of food. A lot of vitamins or the micronutrients, like minerals, are not our food, and our soil is depleted.
Right.
We are artificially fertilizing a lot of our agriculture, and it's not going to be as rich in the vitamins that we typically would have had in the past. So an apple a day did keep the doctor away in the last century. But in this century, because we have these GMO, produce. And so for me, the more local, the better. I always try to get, local in-season vegetables and fruit. And I think we are very blessed in Hawaii to have such great weather. And there's lots of, local fruits and vegetables, and curcumin or turmeric that I think is really essential. I juice my turmeric every day with some lemon, and lemon is really good for the immune system because it has vitamin C.
Right.
So combining them together, it's an immune boost. And I do a little shot with a little bit, of course, you put a little pepper in there to make it absorb better. But there's so many supplements that are immune boosting, and doctors who talk about this in relationship to COVID are, taken down on social media.
I know. It's crazy.
And it has been proven on PubMed. Like, they've done research for, decades on these vitamins and its relationships to the immune system function and cancer. And all of a sudden, when you start suggesting that it could be, used for something like COVID to help prevent, or, I'm not saying treat, but prevention is key.
Right.
And then they're like, oh, no, we're waiting for some drugs and vaccines.
But the
money.
Mechanism,
it's all about money, and the mechanism of how things like hydrochloric work. It actually increases zinc availability in the immune system. So that's the mechanism. If you don't take it with zinc, it's not going to work.
No. Most people don't know biochemistry anyway. They don't understand it. So they're going to make comments based off what they're taught, and that's the thing. You guys are breaking it down to a biochemistry level, including supplementation. So, it has its purpose.
There's so many things. Yeah, everything has its purpose, and I always still keep, and for my patients, because I am still a Western trained doctor, I always look at what do we have available to, not just herbal food and supplements. What do we have available that can help treat inflammation in the lungs? There are lots of things like NAC.
Right.
That's a great supplement. That's a precursor to glutathione. Really good for preventing lung infections. But what if you have an infection?
Right.
And you have inflammation? You know what asthmatics take? They take an inhaled steroid.
Right.
Steroids can help decrease inflammation. We have this readily available.
Right.
So we don't have to be scared of getting, I think COVID is, we have to realize we already have the tools And instead, we are told we need to wait for a vaccine when we have the tools right in front of us.
Yep.
And unfortunately, doctors are ostracized if they are, using vocal and using that. If you're actually, treating and curing COVID, God forbid, you're ostracized by the media. I think that's
crazy.
That's why I don't, and I'll be very clear, we don't treat COVID positive patients in our clinic, but if you want to prevent getting, prevent getting sick when you go, like if you went on flights in the mainland, I recommend anyone who is going to fly on a plane, I don't recommend flying on a plane, but if you're going to fly on a plane, get an IV, because this is like going to help boost your immune system, and you don't have to be afraid. I think that's really like the key. No one should be in fear of getting sick, and unless your immune system doesn't work. And I think that a lot of people's fear of getting sick is suppressing our immune system. So we just have to have faith.
Well, I think you guys are on the right track, though. Not too many people understand that, and I think this is why I have you guys on the show, because I'm a big time advocate on preventative medicine. And if you're sick, you're already too late. I mean, you're gonna heal yourself, but it's better if your immune system was already supported.
Yes,
and that's what you're trying to say. Yeah, exactly. So
yeah. That's the first thing I did when I got out of the hospital. I was in the hospital last week, and
I'm sorry to hear that.
Yeah, but I think that we have to listen to our bodies before we get sick. Obviously, I push myself, but like in that moment of surrender and being like, okay, I'm going to take, because I do both Western and natural medicine. I took the antibiotics, but what I also took? I took a lot of probiotics.
Right.
I came back to my clinic on Monday and I did an IV vitamin C and glutathione. I'm like, it doesn't matter if you get sick. And that was probably the most important thing, like to have that experience of being sick in the hospital, being scared. It's like, it's okay.
Yeah.
It's okay to take the antibiotics, but you need to replenish your biome. Yeah. And if, you get sick, take a vitamin IV, and I felt so much better. But yeah, like I think, we are not infallible. Doctors also get sick as well. And we need to prevent that by, taking our vitamins. Of course, I take a lot of vitamins, just all the time. But to listen to your body, don't ignore it until it's too late.
I agree with you 100%, and you're amazing. Thank you so much for saying that, because I think a lot of people are afraid and don't know, and they think it's, if they get sick at this point, whether it's COVID or something else, they think it's a death sentence, and we don't know, the circumstance, but for the most part, it's not, and it's been told to me by doctors, not me saying this, and people who work in hospitals in the front lines who are telling me this. I interviewed a gentleman last week, and who's a surgeon in New York, and he just says it's a very, very contagious virus. You need to be careful, but at the same time, it's not gonna kill you for the most part. But those small percentages, it does, and that's where my heart breaks for those people. But at the same time, we're lucky. We also live in Hawaii. We are protected to some degree, and but we can't let our guard down either. So that's why I'm trying to send people over to you guys to get their IV therapy now. Mm-hmm. And get treated before and get strong and all that good stuff. But unfortunately, I have to end my session with you guys. I hate doing this because every time you guys come on, it's such a pleasure for me to talk to you, because you guys are a wealth of knowledge, and the clinic that you guys have are so well-rounded. It makes me feel good to be able to share you with my audience. And I want to send them over to you at the Hawaii Natural Medicine. You guys are, like I was saying, you guys are over on Bishop Street, correct?
Yeah,
Bishop and
Barrington. Yeah.
Okay. Yep. What's a good phone number for people to call you guys at?
524-8715.
524-8715. Okay, and then you guys have your website is hawaiinaturalmedicine.com?
Yep, and that'll kind of give us, kind of gives you a good overview of the services and things like that. If you're curious, but IV therapy, we have a couple IVs up there that are
nice.
Kind of give you a general idea of the things we can do with that, and then all the other services, hormone replacement, anti-aging, and kind of, just general
That's awesome.
integrative care.
Wow, that's great. I'm actually looking forward to seeing you guys next week. I am going to be a client, so I will be getting my IV on, hopefully. And then you'll tell me what I can and cannot do. That'd be awesome. So if I'm going, guys, I'll keep you guys posted in my experience, but definitely at least check their website out. It's something to educate yourselves on. But thank you so much for taking the time out again today, guys, and giving me all of us an education on this. It's so important. And I think the work you guys are doing is important. So thank you for treating all of us and keeping us healthy.
Well, thank you, Bianca.
Thank you.
I appreciate being here.
Absolutely. We'll see you guys again. And hopefully if I have another topic that's this type of stuff related, I'll bring you guys back on if you're willing.
Excellent.
Yes,
thank you.
We'd love to.
Oh, that's awesome. All right, guys. Thank you so very much. We're going to take a quick break, and when we come back, we're going to talk with Sarah Johnson over from the Honolulu Club.
The Honolulu Club is still here for you. We are providing the safest workout conditions on the island, with modified safe distancing indoor and outdoor classes, large open work floor with clean, sanitized machines and free weights. Let the Honolulu Club be your one and only fitness destination. Go to honoluluclub.com and fill out the trial pass today.
Have you heard of microcurrent therapy? If you suffer from chronic pain, arthritis, sports injuries, ligament injuries, or migraines, the electroequiscope can help. This non-invasive treatment system is drug-free and shows no negative side effects. If you are seeking pain relief and want to boost your immune system, schedule a demonstration or consultation by calling Kelly, your microcurrent electrotoxologist, at 485-9697 or follow on Instagram at Kelly's Time. Make your appointment today.
All right, guys, we're back. A great conversation with Dr. Benchouk and Dr. Candido. But I also want to bring on a friend of mine who works with me at the Honolulu Club, and we want to go a little bit over what's happening there. And she is the Group X manager and program manager, but she also is a nutritionist, and she's also a student at a Chinese School of Medicine, and she's a well-rounded person, and she's very intelligent when it comes to your body wellness and all that good stuff. But for today, I wanted to bring her on to kind of tell everybody, what are we doing at the Honolulu Club when it comes to group training? And I know that's a topic of discussion for everybody when it comes to their health. They want to work out, but they're afraid of this COVID-19 thing. But I do know this. We have technology in the club that is providing a safety factor when it comes to the surfaces. We Zuno, it's like a terminology that we use. We Zuno the gym, which means that we've actually sprayed down the entire floor, including the Group X rooms, with this product that's antimicrobial, antivirus, anti-mold, and it's good for 30 days, and it protects us around the surfaces. But we also do a lot of other things. But I wanted to bring Sarah Johnson on. Are you on, Sarah?
I'm here. Thank you so much for the wonderful introduction, Bianca.
Well, it's not that hard to do. You're an incredible human being. You've always taught me something, so I always appreciate that. But I wanted to bring you on because I know you're in charge of the group exercise rooms and the control of how things are set up for the club. Can you give us a quick description on what we did for the Group X group department when we opened up?
Sure. So we have a few group exercise studios. They're each lined out. So each participant has a 10-foot box where they'll exercise. So that allows for social distancing. We've also designed each class to be 30 minutes in between the others. So after each class, we sanitize the room, we sanitize the equipment, and then we allow that fresh airflow to go in between each classes. We also have set up a booking system. So the booking system is through MindBody Online. And what that does, that allows us to limit the participants in each class. So based off of those 10-foot squares in each studio, we have a safe amount of participants that can get involved in class, and then they sign up online. And therefore, we can track how many people are coming in to keep it safe amount of spaces within the room.
That makes sense. That's really good because it's not even 6 feet apart. It's 10 feet apart. So you're guaranteeing that safe distance. So, and then the instructors and the students are all wearing masks, right? The membership people.
Correct. Everyone's wearing masks in the studios, exercising on the fitness floor. So yeah, we're just, we're all following that mandate and just keeping everyone safe at this point.
So the cleaning of the spaces is key, is it not, to making sure that each person after use of the studios makes it much more attractive, I think, to our membership that comes through. But for those people that are out there that don't know much about the Honolulu Club, I mean, we're a large facility. Like you said, we have 3 studios, correct? And each one of those studios is used. How many classes are we doing a week?
We have about 80 classes a week right now. So we have a full schedule, that's for sure.
Oh, that's amazing. Because we used to have 100, so we just took out 20 classes to keep with the status of protocols that were mandated to us.
Yeah, we're really lucky. We have such a great housekeeping staff that they, between each class, they come in, they sanitize everything, and just make sure it's safe and clean for the members. So I'm very grateful for our staff. We're all kind of working as a team to make sure that everything is clean and up to, the suggested protocols. And yeah.
Well, you being a stellar of a knowledgeable person, I'm sure you're teaching all your instructors the etiquettes of a well-balanced lifestyle. I want to ask you any suggestions to our viewers or our audience when it comes to staying healthy. I know you being in School of Medicine and being a nutritionist. Any thoughts on keeping balance?
Well, you hit it right on the head, that balance right there. That's one thing that we emphasize in Chinese medicine. And, we have the 2 opposing forces, the yin and the yang. And really, I think the key to longevity and health is finding balance within your life. And right now, it's so important to stay active and keep our immune systems up, eat a healthy diet, but then also have that downtime.
Yeah.
At the club, we have, we have a bunch of very wonderful yoga classes, but specifically the restorative yoga. It works to kind of stimulate that parasympathetic nervous system, which is the system that's going to relax everything and just allow your body to kind of heal and rest up. So just having that balance of activity, but then also rest and, just trying to find balance within your life.
Well, that was good advice, because you just reminded me for me to take the restorative yoga. God only knows I need it. Well, Sarah, I appreciate you jumping on really quick for our viewers, our audience, to understand what the club is doing. You're a great representative of the Honolulu Club, and I look forward to bringing you back on again just to keep us updated with everything that's going on. And I look forward to seeing you soon.
Thank you so much, Bianca. Have a wonderful day.
You too, and thank you so much. Well, everyone, I wanted to take the time to talk to you guys about, your health and well-being. Don't forget, I'm also a personal trainer. I'm also a nutrition coach. I do have the experience to help you if there comes to a point where you need someone to help, design something for you to do at home if you're not comfortable going into a gym. I mean, I get that, but don't forget to look up Be Fit for Health, Be Fit 4 health.com. On there has my bio and my experiences and the things that I'd like to offer. And if you have any questions when it comes to anything about your health, you're welcome to contact me. There is a contact page there. Ask me your questions. I'd be more than happy to help you with anything I can. So this is it for our show today. I thank you so much for taking the time to listen in, and I hope you enjoyed it. I enjoyed having you all here today on Sunday especially. Have a great rest of your day. I wish you all the best. Stay healthy. Stay safe. I wish you aloha.